what's physically happening? An air droplet might come out of your mouth, it gets caught in the wind, and then what? Take us through the steps to, actually becoming, infected with the virus.
So COVID is produced in the respiratory tract along the nasal passages of the respiratory tract and nose and throat. And as it reproduces, obviously that tissue has the ability to try to get rid of things. So when we sneeze or cough, we're trying to get rid of the whatever the irritation is, even dust. So what's happening then, if I'm producing virus, I don't know it, and you are talking to me, and if you're close enough that the aerosols or the respiratory droplets that go out reach you when you inhale, then that goes into your nasal passages, and those droplets or aerosols that have the virus then attach to your nasal passages and begin the replication process for you. And so that's why the social distancing, meaning staying away from people, because if you don't breathe in my aerosols or my respiratory droplets, you won't get it.
In getting people to understand that, you've used something called the trusted messenger. So, could you just explain a little bit to me about what the trusted messenger intervention is?
Trusted messenger then was born from an invitation by actually a bishop in Zambia to come and train his clergy about HIV. This is because they were losing so many people. They were having several funerals a day in the height of the HIV/AIDS epidemic due to deaths from HIV. And there were many myths circulating. Is it a curse? Is it something that was made to destroy African countries? And the truth is, it's just a little virus that needs humans to replicate in. And actually, HIV wasn't even the most strong virus. COVID is a lot stronger because it's a respiratory virus in many senses. I realize that if we understand some of these things, but people don't know to use them, then we haven't completed the full circle.
When it comes to COVID, where have the shortfalls in the messaging and the communication and pushing of an understanding of what the science is and what the proper steps of prevention should be? Where have you seen the ball dropped on that?
One, the messaging has not been there. The availability of testing has not been there. And thirdly, the leadership, both national and in some cases local, has not been there. What I mean by that is this is something that I cannot fix, you cannot fix alone. It takes community effort to do this. And those things are not being done. There is rare leadership. Michigan has been very fortunate in that we've had amazing leadership, statewide leadership, to do the things very cautiously to help prevent widespread infection. And even so, when things open up, we see what happens. The numbers go back up. Even thinking about sending children back to schools, which is another whole topic. I said early on to a group that if I had school-aged kids, I would homeschool them if I possibly could, or work with other parents to make sure that we provided an isolated situation for our children, because we just don't know enough about how this virus works, and we cannot manage the conditions in schools well enough to be able for me to say safely it's a safe environment for children or staff or teachers. So these are difficult questions, but if we stick to the basics of what we do know, we would be much further along than we are with the ups and downs from trying to reopen too soon or trying to do what we think it's normal or what we want to do. This is partially about the human will to care about other people more than we care about what we want to do ourselves. And maybe that's the lesson to come out of this COVID pandemic.